We've been doing a liver transplant or multi-vessel transplant for patients with cancer for many years. But recently, we expanded the indication of the liver and the intestine multi-vessel transplant to other cancer conditions. So now we call it Transplant Oncology.
In the past, the options were really focused on patients who had hepatocellular carcinoma that fit a very specific defined criteria called the Milan criteria. Over the years became an additional indication for patients with hilar cholangiocarcinoma, or what we call Klatskin tumors. And that's pretty much how we knew it until we started to really expand options over the last few years. Really, it started with thinking about patients with hepatocellular carcinoma, pushing the envelope beyond those with that standard criteria, maybe those with limited invasion of some of the vascular involvement. We think of that as kind of branch portal vein invasion, which previously, again, was not considered for transplant. Another area is that of patients with intrahepatic bile duct tumors or intrahepatic cholangiocarcinoma. There's been a growing push to think about patients with neuroendocrine tumors, and though that has been accepted in the past, the criteria have been loosened to a certain degree to expand which patients would qualify. Probably the area where we see the most increase in data recently is for patients with colorectal cancer metastases to the liver. So these are patients who have a history of colon cancer, but now it's started to spread, but really has only spread to involve the liver.
Our program tried to disseminate this idea to, like, for example, local physicians or oncologists, even like APPs or even patients. We want them to be aware that liver transplant can be the option for those cancer conditions, so that we can provide those opportunities to patients, as many as possible.
That's going to help get the word out that for our patients, they have this as a potential option. And because it's still rather new, it is important that we all start to share this information.